Good day and welcome to Scholars Universal online classes for SS1 Science. Today we'll be having biology. Another biology we'll be talking about topic health organization. The last class we talked about ways of good health. So in previous class we talked about the way we can achieve maintenance of good health in our environment through refuse disposal, sewage, efficient sewage treatment. We learned about the functions of the public health authorities and function of individuals in maintaining good health. So we're now looking at the health organizations. And this picture here we have UNICEF and the International Red Cross. The two are international health organizations, but they are not the only two. So let's learn about one of them. Health organizations are corporate, maybe local or international bodies concerned with the maintenance of good health of the people. International health organizations include World Health Organization (WHO), United Nations Child Emergency Fund (UNICEF), International Red Cross Society, and the major local health organization in Nigeria is the Nigerian Medical Association. So each country has its own health organization, but we the whole health organization are under an international body. So an example of all these international bodies is the WHO, UNICEF, and the International Red Cross Society. So let's look at the functions of each of the international health organization, including our own local health organization here in Nigeria, the NMA. So the Health Organization, this is a specialized division of the United Nations established in 1948 with the headquarters in Geneva, Switzerland. So in 1948, the United Nations organization, that is the countries under United Nations came together to establish World Health Organization in 1948, putting the headquarters in Geneva, that's in Switzerland. Its major aim is to improve the health of the people in all countries in the world. So that's the major aim of WHO, is to improve the health of people in all countries in the world. So they are the one in charge of a major outbreak like this coronavirus. They are the one in charge of saying whether there is vaccine, whether there is a vaccine for the coronavirus or there is no vaccine. So they are in charge of that. The UNICEF now, this is another special agency of the United Nations organization. Was set up to improve the health welfare of children all over the world. As you can see in the definition, you can see United Nations Children Fund. So this ones, their own is with the children all over the world. They are in charge of maintaining the health welfare to improve the health welfare of children all over the world. The Nigerian Medical Association. The Nigerian Medical Association is a national body concerned with the maintenance of good health within Nigeria. So the is with the this health organization is just to watch or maintain the good health within Nigeria, while other health organizations like the World Health Organization, the UNICEF, they are international bodies. They try to maintain the good maintenance they try to maintain good health across the world. So let's look at the functions of WHO. Promotion of measures for the control of world major diseases through vaccination programs, use of antibiotics. It coordinates. Also, let's look at the functions of WHO. The first function here is promotion of measures for the control of world major diseases through vaccination programs and use of antibiotics. Yes, that's the major function of WHO. They are to control world major diseases like this coronavirus, which is a major outbreak, through vaccination programs and use of antibiotics. There's one that provides the drugs used in curbing world major outbreaks of diseases. So through either vaccination programs or use of antibiotics. Two, it coordinates research programs in all fields of health, making results known to all member nations. Yes, like in all fields of health, they coordinate research programs to learn new diseases, new microorganisms, new diseases, and they make the result known to all member nations. Thereby, they make the result known of a new disease its cure, its how it's being transmitted, and other facts known about that disease. They make it known to all the member nations under under the United Nations. We have provision of advice and help on health matters to member nations. Like when there is health issues in some nations, they provide advice and help. They publish medical journals. Yes, medical journals being written by the doctors of health. They help in publishing it, thereby making people to be aware of new diseases or a new outbreak. Helps to set up international quarantine regulations. Yes, they are the one who set up the international quarantine regulations. You should know about this coronavirus. They used to say that if you are showing symptoms, quarantine, or if you come from a place where there's coronavirus, you have to quarantine yourself for 14 days. It's WHO who brought up this quarantine regulation. So meaning that it is accepted worldwide. So they help in setting up international quarantine regulations. They help in provide provision of drugs and vaccines in case of emergencies. Like in case of outbreak, they quickly provide drugs and vaccines to curb such disease. Provides warning signals in event of outbreak of epidemic disease. Yes, they are the one who warn other countries about the outbreak of a disease in another country so that it will not lead to a larger scale of patients in the whole world. So they assist national health organizations in controlling of disease. Yes, they assist national health organizations in control of diseases both within the nation and outside the nation. They assist to control it in order to not have an outbreak within a country and another. Helps in maternal and child health care. That means they help in both mother and child health care. They help in making them healthy at all times. Helps to set and recommend safe standard for drugs. Yes, they are the one who set and recommend safe standard for drugs, meaning that they are the one who says that the drugs are are not harmful to the body, or they put down the standard for such drugs. Like the malaria drug now, they will put a standard that this drug must have a percentage of this ingredient, must have a percentage of this ingredient. So that standard is what they will now use to recommend whether the drug is safe or not. So those are the few functions of WHO. Now let's look at the functions of UNICEF. UNICEF health functions are to provide the emergency needs of children in devastated areas, like where there is war or insurgency. They provide emergency needs for the children in order to prevent malnutrition or death of children, to improve the nutrition of undernourished children. Yes, in some countries, some children are undernourished. Like in Nigeria, we have what we call the almajiris. They are children with parents, but they don't have enough food. So the UNICEF is the one in charge in order to provide food for such children. They feed destitute children, to supply vaccines and equipment to prevent the diseases that especially affect children. So their own is just to provide equipment or vaccines to prevent diseases that specially affect children. They are concerned with children only. So the diseases that affect children, they provide the vaccines, such as whooping cough, poliomyelitis and tuberculosis. Yes, poliomyelitis now is what is common here in Nigeria, where they would say from 0 to 5 they should come and have injection. The injection they give them is just that to make their immune system strong against such potent diseases. So they make children immune system to be strong. They provide children clothing and other needs. Yes, they are to provide children clothing and other needs wherever the child may be, whether in devastated area or a place of insurgency. The child may not have enough clothing, may be wearing rags. So it is UNICEF that is in charge of providing children's clothing, to assist in the improvement of mother and children by providing training programs and necessary equipment. Yes, they assist in the improvement of the mothers and their children. Like a woman who gave birth but does not have how can I say, but does not have special skills. Like maybe she does not know how to do, she can't be a tailor, she doesn't know how to do anything. They help by providing training programs, thereby making the woman equipped with a skill. So thereby she can provide food and shelter to her and her children, and they provide the necessary equipment to do that. So their that's their major functions. And now let's look at the function of the International Red Cross Society. They function in two ways: in time of war and in time of peace. So in time of war, they take proper care of injured, they provide emergency aid to those in distress. Like when two countries are in war, they are the one in charge to provide care for the injured. They provide emergency aid to those in distress. They are involved in the negotiation of prisoners of war between countries. Like if a country has some citizens of the other country in its own country, they are prisoners of war. But in if the other country now wants to collect its citizens back, it is the International Red Cross Society that will now negotiate or be the middleman between the two countries. They provide transport for evacuation of refugees. So like refugees meaning that those that are living in other countries but they do not have place to live, but they are just wondering about, they provide transport for the evacuation so that they can transport them back to their country. They also provide welfare for prisoners of war. Like as the citizen has been caught in another country, they provide welfare for them by providing shelter, food, clothing, and so many other needs for the prisoners of war in order for them not to feel deranged or they should be traumatized. In time of peace, they provide general first aid to patients. That means patients all over the world, they provide general first aid. They assist in preventing accidents. So they are involved in preventing accidents. They assist in training of nursing aides. Like a person who wants to be a nurse or wants to help in health, they give them basic training on how to be a nurse. They maintain children and maternal welfare clinics. That means they build the clinics built for maternal and child welfare. They maintain them in order for them not to be destructed, or they should not be in use again. They maintain them to meet up with the needs of the mother and child. They provide to help victims of natural disasters such as earthquakes, flood and fire. So where there is earthquake, flood or fire, they help the victims to gain back their to go back to their normal days, to help them to forget about such disasters. So that's what they do. So now let's look at the functions of our own local health organization, the NMA, Nigerian Medical Association. They advise government on how to improve the health status of people. That's their first function. They help the government in helping to improve the status of the people. They alert the nation where there is an outbreak of disease. Yes, they are the ones who will alert the nation, who will say that this disease is now in our country. They are the one in charge of that. Carrying out research into ways of preventing and controlling disease. Yes, they will now go into research on how to prevent and control some diseases. They monitor the requirement of well-trained doctors in the hospitals. Yes, they are the one monitoring the requirement. Like if an hospital is lacking a well-trained doctor, they are the one who would pick a doctor who is well-trained from another hospital and transfer him there to make health 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 care to go better. They assist in training of medical and paramedical staff needed in healthcare delivery. So paramedical means that those that will help the medical doctors or nurses that are needed in healthcare delivery. So these these functions are few of the functions of the Nigerian Medical Association. So I believe we've understood or taken some points out of these functions of each of both the international and the local health organizations. So till we meet in the next class, thank you for listening, and like and subscribe this channel and contact us on WhatsApp if you have any questions, and visit our website For further details, scholarsuniversalschool.com. Thank you for listening.